It was a quiet December evening in 2019, when the world was blissfully unaware of the looming storm. Across the globe, people were preparing for the holiday season, unaware that a virus, smaller than a speck of dust, was rapidly spreading through a distant city, Wuhan, China. At first, there were murmurs, whispers of a strange illness. In the crowded markets of Wuhan, some people began to fall ill, but no one thought much of it. Authorities initially dismissed the reports as a localized outbreak, but the virus had other plans. It spread like wildfire, and by the time the world began to notice, it was already too late. In an eerie, quiet announcement, the World Health Organization confirmed what no one wanted to hear: COVID-19 was real, and it was a pandemic. The virus didn't care about borders, didn't care about the rich or the poor. It didn't care who you voted for, where you lived, or how much money you made. Healthcare workers donned masks and face shields, treating patients who were isolated in rooms that felt more like prisons than places of healing. People hoarded toilet paper and food, unsure of how long they would need to stay locked inside. Streets once bustling with life became eerily quiet. Restaurants, theaters, and schools all shut down, leaving the world in a state of suspended animation. Hospitals in New York City, Milan, and other major cities were overwhelmed. Medical professionals, once celebrated as everyday heroes, now found themselves at the front lines of a war they couldn't see, fighting a battle they didn't understand. The threat wasn't just the virus, it was the uncertainty. How long would this last? Would life ever return to normal? In the quiet of lockdown, people turned to technology to fill the void. Zoom calls, FaceTime chats, and social media became the only means of connection. But there was a dark side to this digital connection. Conspiracy theories spread just as quickly as the virus itself. Then, just as the world had nearly lost hope, a glimmer of light appeared. A vaccine. The announcement of a vaccine's successful trials sent ripples of excitement and hope through the global community. As vaccines began to roll out across the globe, new variants of the virus began to emerge, more contagious and more resilient than before. Just when the world thought it had won, the pandemic threw another twist into the plot. The race for immunity was on, and people now had to balance their hope for freedom with the reality of the virus's ever-changing nature. Each day, as the number of vaccinated people grew, another mystery emerged. Were we nearing the end of this? Or was the pandemic just evolving into a new phase? Stories of triumph and tragedy continued to pour in, and as nations reopened, the world faced a new challenge: how to heal not just physically but mentally and emotionally as well. And now, here we are, years after the first whispers of COVID-19 reached the world. Some places are slowly returning to what they once were, but the scars of the pandemic remain. Lives lost, relationships strained, and societies forever changed. The question remains, will we ever truly recover? Or have we entered a new world where uncertainty and resilience define the future? Only time will tell. But one thing is certain: the world will never forget the time when we all stood together, apart. As the world begins to emerge from the shadows of COVID-19, some ask if the pandemic truly is over. With new variants emerging and whispers of possible future pandemics circulating, the story of COVID-19 isn't just a chapter in history. It's a warning, a reminder that sometimes the most dangerous enemies are the ones we can't see. And as the world continues to heal, we can't help but wonder, what's next? The world will never be the same again, but we can learn from the past and work towards a better future. We must work together to build a better future for all. We must remain vigilant and prepared for any future pandemics. Please subscribe my channel to get notified for my latest uploaded videos.